Okay, so I'm the one to start in our group. I'm happy to give you an introduction to our topic and research question. So the title of our research of our project is Identify and Map Interventions Impacting Meat Consumption in High and Middle Income Countries. Could I have the next slide, please? Thank you. So to give you a broad background, high meat consumption largely contributes to global environmental and health challenges such as climate change, loss of biodiversity, and cardiovascular diseases. There's a rising agreement that meat consumption needs to be reduced where current rates are high. Yeah, this is basically in all high and middle income countries. The IPCC, the UN, as well as the Atlantic Commission already called on nations to take actions to reduce actual meat consumption rates. However, there's little evidence on the effectiveness of measures. So this is what brings us to a necessity of a systematic map to provide a comprehensive overview of existing interventions. So the aim of our study is to identify and map these interventions that impact consumption, purchase, and also selection of meat and also meat products in high and middle income countries. And now I'm happy to hand over to my colleague, Lawrence.
So these are our PICOs. We are interested in, as we said, high and middle income countries, and to make that easier, we used OECD countries as a proxy for that. We looked how healthy adults are framed on the net, and this is the first result of our study, the lady on the right. We looked for interventions that are designed to influence meat consumption and purchase. Our counterfactual is no intervention, and we have meat consumption, meat purchase, and willingness to pay as outcomes. Next. We search databases that are commonly used in that field: Web of Science, Scopus, Publish or Perish for Google Scholar, and CAPI. We narrowed down the population to capture only humans by using the terms below. Also, the intervention exposure we defined as either intervention, policy, measure, campaign, labeling related terms. And outcomes, we combined different types of meat with intake, consumption, buy, purchase, acquire, and also preference, food choice, and selection, because these are common terms in the field. And this is the resulting Boolean string. And as you can see at the top, we included all countries that are in the OECD as a kind of positive list to get all the studies done in these studies. And I pass on to Barbara, I believe.
So afterwards, we conducted the screening, first on abstract and title, and thereafter on the full text. And our inclusion criteria is based on the PICO that Lawrence just mentioned before. What we added in addition to our selection criteria was the year of publication. So we only included studies that were published between 2011 and 21. And the publication types where we only included like peer-reviewed article and conference papers. Next slide, please. Yes, in order to assess our consistency of the decisions when we were interpreting the inclusion criteria, we calculated the Cohen's kappa, and our group did quite well. So we had a kappa score of 0.74, which gives us a good agreement. So we could continue the screening without dual screening. And this is only a short example of our data extraction sheet. So we would extract data on the article in sense like the authors, the year of the publication, the journal, and the country level. Then we will extract data on the study design, on the population date. So what was the age of the population, the sample size, and the gender. We would include information on the type of intervention, like in this example below, the type of intervention was nudging, like one dish of the day strategy, like a vegetable dish was the nudging strategy. And we, of course, include also information on the outcome level. So in our case, it would be the behavior, which we could further specify whether meat was consumed or not consumed, or whether meat was purchased or not purchased, or also like whether there was a willingness to pay for meat or not. And in this one example, we also included the effect of the intervention. So in this case, there was no difference between the dish choice, the choices between the control group and the intervention group. We are aware that this is only at first summary of the data extraction sheet, and that we would need to further develop it after piloting more full text studies. Next slide, please.
So just to give you an overview of how many studies we dealt with, when we first started searching with our Boolean search string, we got over 7,000 hits. After deduplication, it was still a bit above 7,000, and after title and abstract screening, we were just left with 37, and we were only able to get 30 of those at full text and so on. So in the final review, there are 22 plus 3 articles and studies included, and at this point we stopped since our question was a systematic mapping question and not a review question. As one of our preliminary results, we identified interventions, for example, the nudging strategy by, for example, a dish of the day strategy, so where one dish is well, more readily available or presented as nicer than the other ones or cheaper or something like this. Or a different example of a nudging strategy is the design and stuff of the sweets. So nudging can go in different directions. Another intervention we identified was carbon labeling, where the different products were labeled according to their carbon footprint. And it's just to say that the nudging strategy seemed to be the most prevalent in our data set.
Yes, this comes to we also looked at where these studies on nudging have been conducted. And as you can see, there are only a few countries actually covered by this strategy, and it's only European countries and not of the other OECD countries. And therefore also we have to be very careful when we think of our giving recommendations so we would highly recommend also to look into more other nudging strategies for future interventions before giving it as a policy recommendation. So we are already concluding our short presentation. I hope you really enjoyed, you learned something, and looking forward to your discussion. And we also would like to thank the supporting OXSREV team in giving hints and doing our research. Thank you very much.